Hi guys, my name is Heidi, also known as the Transcultural Nurse. Welcome to my YouTube channel. You might be wondering what's a transcultural nurse when it's at home. Well, the most basic way for me to explain it and how I understand it is it's a nurse who can care and treat people from all cultural backgrounds. You might be wondering, well, is there a need for this? Do we not all treat people with the same level of care and respect? And well, the answer is simply a no, we don't, particularly in mental health. So if you stay tuned, I'm going to give you 10 things to consider if you're thinking of embarking on a career in mental health nursing. So just a little bit of background about myself. I am a mental health nurse by background. I've been qualified for almost 12 years now. I have also got a degree in public health nursing. I worked as a health visitor for a few years. I've done a postgraduate certificate in transcultural mental health, and it is something which I am really passionate about. And within mental health nursing, it's something which you will definitely come across. You might not know it. So this video is reaching out mainly to people who want to embark on a career in mental health nursing, be that student nurses already on placements, be that apprentice nurses, carers, or even those who are already qualified who wish to know a little bit more about how to become culturally aware, culturally competent, culturally intelligent, and a bloody good transcultural mental health nurse. So if this is the kind of thing that you would like to hear more of, please subscribe to my channel because this is my passion. Let's get into it. So number one, ask yourself, why do I want to become a mental health nurse? Now, as basic as what it sounds, you might be thinking, well, I want to be a nurse, and why is she even asking me this? Because anyone in the right mind surely knows that they want to be a nurse when they set out to do it, but you'd be surprised to hear that people don't always want that for that reason. I became a mental health nurse not because I wanted to be a nurse. I did it because I was in an environment where I ended up in a psychiatric environment, not personally, but I ended up working as a cleaner in a local hospital. After a few months, I got a job as a support worker. I kind of got to see what went on, the different types of people who came through the doors and who were cared for. I got to see how the doctors worked, how ward rounds went on, just the general kind of feel for it. And I decided, yeah, that's something which I could possibly do. So I ended up as a support worker. After, I think, 4 years, I inquired about becoming a nurse. So looked on ACAS, asked a few people what it would take, what the assignments, etc. were like, what was the demands of the course. And I thought, well, seeing as though I'm already kind of in it, why not? Had nothing to lose. I wanted to progress, and so I went and did it. So that was that really. But the reason why I say ask yourself why you want to become a mental health nurse is for various reasons. One, it could be like me, you just naturally fall into it through your own job. You could be a person who's had lived experience of mental illness and can actually, put their experience to good use in helping other people. Yeah, what else? So you could have cared for somebody with mental health problems and have been told or can see it within yourself that you have the qualities to care for people, and maybe you've got some good feedback, or you've had good results, or you feel like you're a good person to talk to. So yeah, consider, because if you were going to become a transcultural nurse, so the relevance is on working with people across cultures, really you need to understand why. Because you're going to be dealing with people who, although are mentally unwell, may not have the same idea as mental health that you do, okay? And also for me, although I didn't want to become a mental health nurse per se, I think from a young age, I'm mixed race. My dad's from the Caribbean. I grew up in a very white English village in the northeast. I, didn't get to see a lot of people like myself because there weren't any, and I always had an interest in people from different parts of the world. I think I saw myself as being different. Therefore, I kind of sought out other people who were like me. And as I got older, I developed an interest in refugee refugees and the plight that refugees undergo. So I decided to volunteer for a local refugee organisation, got to meet some amazing people and sort of started asking, well, how come these people go through so much? They cross, go to the ends of the world to seek sanctuary, seek safety, flee persecution, yet still have a smile on the face. They welcome you into the home. They've got such strong faith in God, perhaps, or, they had good reason to go to those lengths to survive. And, even when they were going through the asylum process, although it was extremely stressful because these things can take years to happen, I just saw something in these people which I'd never really seen before in people from the UK. So I kind of took those experiences of doing the voluntary work, sort of saw a mental health aspect of that, an element of that, and thought, well, maybe within a career of nursing, I could apply that to the role of a nurse. So that kind of became my interest in becoming a mental health nurse. And it did take a while actually to get into that as a nurse because it was very niche. It was not the real done thing. There was a few services out there that catered for refugees and asylum seekers, but it was mainly services that sort of did sort of physical and medical examinations on arrival, like arrival services, and kind of, that freed up GP services. So it wasn't like there was mainstream mental health services back then for asylum seekers and refugees. They kind of either got seen within the arrival service or they kind of got picked up by the GP and maybe referred to secondary care. But yeah, so I'm just saying, ask yourself why you want to become a mental health nurse, because there's no right or wrong answer, but it might be that you just fall into it by default. Another point in relation to why you want to become a mental health nurse in the context of being a transcultural nurse is just being aware that you will be working with people from all over the world. I started my career off in the northeast of England where there was a small demographic of ethnic minorities, for want of a better term, and a lot of them were like second, third generation, or there was more recent migrants, but in the northeast the majority of the demographic was white British. So just be mindful that if you are kind of working in more of a major city, or you kind of want to take your career further, you want to do an alternative placement somewhere else, that you will be nursing people from all over the world. And you've got to start wondering about your own kind of biases, your own thoughts about other people, your own self-awareness, and do you feel that you could have the qualities to nurse people who don't speak English or have a culture that's different from yours, or maybe care for someone who you thought you'd never end up ever sitting in the front room and drinking tea with, because all these things you will end up doing, guarantee it. So I just suggest that in the first instance, consider these things, because you will no doubt come across people from different cultures, and it's just a case of being mindful of yourself and any of your own prejudices against anybody, be it an ethnic minority or be it anybody. But you just need to be asking yourself, am I able to be flexible enough to nurse everybody in a way that meets their own needs? Number 2, reflect on your definitions of mental health and mental illness. Okay? It's important that you do this because everybody's got their own definition of what constitutes mental health, be it being happy, being content, feeling valued, feeling empowered, feeling positive, feeling bright, feeling cheery, feeling joyful, feeling happy. There's any amount of ways in which you can describe what mental health is. It could even be absence of ill health. And so how therefore do you define mental ill health? Is it feeling sad? A feeling of emptiness? Is it despair? Yeah. Could it be anxiety? Could it be hearing voices? Yeah, could it be feeling suicidal? Could it be, taking yourself off and, harming yourself? There's lots of different ways in which you can explain or define what mental health and what mental illness is. But the reason why I'm saying is consider, what your definitions of mental health and mental illness are, is because, again, going back to the transcultural context, a lot of people from different parts of the world will perceive mental health and mental illness very differently to the kind of European definitions. Yeah, what you might read in a textbook, or if you're looking at the World Health Organization definition of mental health, you might be speaking to somebody who's never even heard of mental illness before, or have a cultural explanation of what illness is or what madness is. Yeah, so when we talk about mental health, just be mindful that when you're dealing with people from, various different backgrounds, that don't be surprised if they've never even heard of the term mental illness. Yeah, or they may attribute their struggles to not being faithful enough to God, as an example. They've done something bad, and therefore something bad is happening to them as like maybe a karmic response. There's all sorts of different interpretations in terms of how people perceive and experience and express illness and distress and wellness as well. And when we, as a nurse, when we deal with people, we have this kind of often textbook definition of what it is to be psychotic or mentally ill, or what's outside the norms of, somebody's culture. But do we know enough about different cultures to be able to say that what's abnormal in one culture may be perfectly normal within another? So it's really important that you start asking yourself, well, what does it mean to me, and is it the same for everybody? Do we all experience it universally? Do we all perceive it universally? Or do we maybe attribute it to something else, something higher, something more spiritual? Perhaps, yeah, because you will no doubt talk to people who say things like, I'm hearing the voice of God and it's God's will. Therefore, what's happening to me isn't good, but it's punishment, so just be mindful that if, when we're talking about transcultural nursing, people will have their own explanations, and you can't just assume that because this person doesn't have the Eurocentric view of health and well-being as you might have got through your 3 years and think the score. But actually, it's important because there's a massive, there's major disparities in health for people from backgrounds, from different cultures, disproportionate detention rates. Black people particularly are detained at massively higher rates than white people, and it's generally due to things like not being culturally aware when you're doing an assessment, not really understanding racism and how it manifests and how it affects people's trust. There's lots of factors, and it is very complex, but if you're kind of dealing with people in a way which kind of only suits a one world view, then you're gonna encounter problems, and people are not going to get fair service. People are not going to get treated and their needs met according to their culture and their beliefs. So that's number 2. Number 3, don't assume that just because you may have worked in mental health beforehand that you'll make a good nurse. So often people end up climbing through the ranks, becoming a support worker or a care assistant, doing their NVQ or doing whatever in their own kind of line of work, and then thinking, oh, I've done this, and feel that entitlement to become a nurse. And I'm not saying don't follow your dreams, and and I'm not saying experience isn't an asset, because it does help massively, because you get to understand things which you wouldn't if you didn't have the experience. It kind of goes without saying a bit, but not everyone has the qualities to become a nurse, because being a nurse, you're accountable. Yeah, you've got to work as a team. You're responsible for people who are unwell, and that some of the decisions you make will influence a person's future potentially, you know. So just think about your experiences. If you are experienced, if you're a senior support worker and think you can do the job, then you probably can, but just don't assume that you'll make a good nurse. Sometimes when we've been in a job for such a long time, we can become complacent, or we can kind of look up to people who've been in the job for a long time, doctors, nurses, OTs, different members of the MDT, and you want to perhaps emulate them, and you're listening to the conversations, you're looking at how people operate within the team, and you're thinking, that person seems really competent, they know what they're talking about, they're really skilled, they're really knowledgeable, but you actually come to learn as you're doing your training that there weren't all that. And that sounds really, it doesn't mean to sound arrogant of me to say that, but you only know what you know when you're doing a job, unless you're constantly learning and evolving. So it's easy to get stuck in a rut of doing the same job, seeing the same people, practicing, thinking that they know everything because that's the done thing. And then you want to emulate them, and you pick up habits and you pick up terminologies and you pick up things where you might say, oh, this person's this because that's how that person said it. Or I've read their notes and they're right in a way which, yeah, I really get and I really like, so therefore I'm going to copy them. Well, no, because then you just fall into the habit of being like somebody else and you're not learning, you're not evolving. So therefore, I've met people who have never done the job, they've never done a day's work in a care environment, but they might have had their own personal, lived experience of mental illness, or they've cared for somebody, or they're just curious. They might just want a career change, or they might just kind of fancy it. And they've often been brilliant. They've made really good nurses because they go in with an open mind. They're not sort of bound by any prior bias. Yeah, they want to learn, they've got a good attitude, and they're like a bit more of a sponge, a bit more kind of pliable and receptive to new information. So it's kind of just saying anyone can do the job with the right qualities, but don't assume that just because you've worked in a healthcare environment that you would make a good nurse, because trust me, that's just not the case. So also, just going back to the point about don't assume that just because you worked in the field that you'll make a good nurse, is that you've got 3 years of being a student, and when you think that maybe that you know everything, and then you come and you're starting from scratch with everybody else, it is a massive learning curve. I mean, I had 4 years of experience before I did my nurse training, and even for me, although I did feel a bit of an advantage at times, I was in new environments, new placement areas where I'd never been before. I was talking to different staff that I'd never come across before. I'd been in like the private sector where I'd done a lot, most of my places were NHS. So it was completely different setup, completely different patients, and I felt out of my depth a lot of the time, and which wasn't a bad thing because I learned a hell of a lot, and it is a steep learning curve for anybody. Nobody knows it all. So, don't feel that if you haven't had the experience that you're not going to be good at it, or you're at a disadvantage, because you certainly won't be, as long as you've got passion, as long as you've got dedication and commitment and you want to help people, then, you're definitely not at a disadvantage. Point number 4, be critical. Okay? Be critical. Start being very critical, because we get taught to be critical thinkers. We critically analyse research, in our assignments we're taught to be analytical and, conduct an argument. Don't just take one argument and then kind of make a conclusion from it. We have to exercise critical thinking in this line of work, because working in mental health it's fascinating, and it's every day is a school day. You're meeting people every single day with different presentations from different backgrounds, with different prognoses, with different things that you've never heard of, or comorbid problems, or they've got a lot of social issues. There's just so much that you cannot have a narrow mind or you cannot exercise critical thinking, because in order to be a good practitioner, you should always scrutinise and never take anything as gospel. Even if you read a textbook, and going back to when you're questioning the definition of mental health, even in an assignment, you know, a lot of the time you might start with mental health is defined as, and might give a quote from the WHO. But I just say, if you're going to do that, bring in a counter argument. WHO says this, however, in the Persian culture, where they practiced psychiatry way before it was westernized, they defined it as this, or this is how they dealt with it. Okay, so be critical, bring in a counter argument, because the problem is, when you're working with people from different parts of the world or with different cultural backgrounds, you cannot apply a one-size-fits-all approach to a massive demographic, because it just will not work, okay? And even, I'll go as far as to say, as a student nurse, if you're on an assessment with a nurse who might be assessing somebody who's, maybe a recent arrival from Libya, and just as an example, they don't speak any English, okay, you're working with an interpreter, the nurses got the paperwork ready and all that, got a bit of a brief outline of the history, the referrals come in, they think they're prepared to what to say based on the information that they've got. You're sat there, you're like, yeah, okay, I'll watch and listen to what you're saying. And you might pick out things that this person said, this patient said, that the nurse might not have picked up on, or they might have kind of took it with a pinch of salt and not really questioned it. Yeah, the person might talk about the migration journey, they might not. They might talk about their culture, you know, they might talk about the family, the home, you know, where they're living, maybe it's not good. They might talk about subtle things like the physical health, perhaps. Yeah, they might talk about a lot of things which may or may not get scrutinised. So somebody might not document it and think, oh, well, they just said that, that's nothing. Or they might document it and totally overlook the hidden meaning. There might be some meaning behind that. So I'd say, if ever you do come across like an instance like this, where you're in an assessment and you think, maybe I would have asked a question this way, or why did she ask that? Or if you're looking at the write-up afterwards, you might think, I really want to ask about this because I thought this was important to that person and you've not included it. Yeah, or she's made it out to be this way and it wasn't. Just ask the question. Just don't be afraid to ask questions. Don't be afraid to criticise someone else's work, because you're not there to be anyone's friend, and it's not about being friends. You're there to learn, okay? And if a nurse can't handle you saying, like, how come you asked this or you didn't do this, then, you know, if they get defensive, then they've got something to hide. Because I've been a nurse for 12 years now, you know, and in those 12 years, I still don't know everything, you know, and I feel like I'm doing this YouTube channel not professing to know everything there is to know about transcultural mental health, because I don't, trust me, I feel out of my depth doing this. But there's a lack of, there just isn't enough education around these issues for me. So I'm daring to kind of take the step forward to try and put it out there and try and educate people, especially prospective nurses, because it's important that the next generation of nurses are more clued up. Yeah, so I would just say be critical, demonstrate critical thinking, because it'll be expected of you anyway. In the theoretical side of things, in the academic work, you'll be expected to demonstrate critical thinking in your assignments, in your dissertation. So why can't we do that when we're in practice? We should be doing that. So especially in the context of transcultural nursing, you will just ask the question, or you ought to feel that you can ask the questions, okay? So don't be scared. And even don't be scared sometimes if you are with somebody and they're telling you stuff, to ask them, you know. Don't feel that you're going to insult people, because you're there to help them ultimately, you know, and there's going to be some miscommunication or things lost in translation. But it's a good opportunity for you to learn. yeah, and for you to reflect on that. So exercise critical thinking as a student nurse. Point number 5, dare to be different. Okay, dare to be different, be yourself, ultimately, be your authentic self. For me, I think I've always been different. I think I've always grown up feeling different. Definitely, you know, I grew up, like I said, in the northeast. I was in a white village. My siblings were mixed like me, but, you know, me personally, I felt very different and I couldn't hide. You know, there was nowhere to hide. Couldn't hide from my skin colour, and it wasn't always favoured. You know, sometimes I was targeted for being different and I always knew it, and it did hold me back quite a lot growing up, and even as an adult it has hindered me quite a lot just through my experiences. However, I've realised that being different is actually good, and who would want to be a follower anyway? Who would want to be the same as everybody else? Especially when you're working in mental health, because you're going to be coming across people who've got issues with their own self-esteem, issues with feeling different, or they've been in an abusive relationship, or they feel ostracised by the family, they've been disowned. You'll be able to relate to people so much. So use your uniqueness to your advantage in your practice. We're all different, yet we're all the same. We're all human, but we've all got something else to bring and to give. Yeah, and if you've got a passion, like I did with refugees and asylum seekers, I'll let it be known in my work, my written work particularly, and obviously whilst in practice. You know, I'd maybe base a case study on a person, yeah, or did my dissertation on the asylum process. So if you've got personal qualities, even quirks that are different, and you feel that people respond to that well, or you resonate with people and they kind of gravitate towards you, then don't be afraid to use that, yeah? Because these are the things that are going to make you stand out from other people, and these are the things that are going to make you shine and allow people to feel at ease with you and able to open up, yeah? Because when people want to be in the in crowd, or when they want to sort of be seen as a person who knows the stuff, or, you know, you can be quietly confident and know your stuff. You don't have to follow the crowd, okay? When we're working with people from different cultures, people are different from us, yeah? In lots of different ways, okay? They might be linguistically different. They might be of a different class, different colour to you, eat different food, believe in different health beliefs, yeah? Expect a certain level of care and treatment. They might not know about the culture in the UK. They might not know how to navigate through the mental health system. So you're going to have to kind of understand your own differences and embrace it, and also embrace the differences of the people who you're caring for. Yeah, you can't say, oh well, I'm different and I'm going to practice in this way, and then just expect patients or service users to fit neatly into your assessment criteria or your diagnostic frameworks. You've got to open your mind to these people as well in their world, and they'll let you in as long as you have an open mind and you be yourself with them and they'll be themselves with you. Yeah? So let it be known in your practice, let it be known in your work, because one thing I do know is that academics like people who write differently, who bring something, a different argument in an assignment. You know, I remember one of my lecturers saying he was sick to death of marking assignments to do with ECT and antidepressants and stuff. You know, people have done it to death. But when someone brings something new and different to read, it generates a different way of thinking, you know, and that contributes to the evidence base ultimately, because somebody else, if not yourself, will take on that piece of research and explore it. You never know. One day you might have your work published in a journal. You might be writing a book. So yeah, dare to be different, dare to be you, and don't apologise for being authentic. Point number 6, get rid of your ego. Okay, I say get rid of your ego because when you're in a caring profession such as nursing or the medical profession, it can go to our heads a little bit. It can, the power, you're in a position of power. Look, you might be part of an assessment where you're detaining vulnerable people or your decision, your report can determine the outcome of someone's mental health review tribunal. Yeah, what you say, what you document in a person's notes can determine how that person's viewed by the next shift, or how that person's viewed when they're referred on elsewhere. What kind of you've seen of that person will be read by others. And when you've got such power, or you're in a position of power, you can actually abuse it, maybe without even realising it. Yeah, you might have come from a background within mental health or a healthcare profession. You might have had I don't know, you might have had a career change and been a police officer. Whichever area of work you've come from in the past might kind of have set your ego up to think you can do this job. And I'm saying lose your ego, because you know better than the people who you're caring for, okay? You might think that you're the big I am because you've done your level 3 NVQ, or you've done your access course to health, or you've worked in the industry for 20 years. But, and I'm not saying that to be condescending or patronising, but I've seen it so much myself, where people get into a position where they then start to abuse it, or they think that they're top dog because they can or they enjoy being in a restraint situation, or they like the ego being struck because of the bit of muscle on the ward. Yeah, or they're the person that people go to when shit's gonna hit the fan, and they'll call someone in to handle it. There's nothing wrong with being confident as a person, but when it becomes arrogance, or your ego gets in the way of you caring for people, you need to just think about why you're in this profession, or why you want to be in the profession. Yeah, because people, you'll be caring for people who are doctors, who might have been a doctor or a lawyer. They might be homeless. They might be from, I don't know, there might be a refugee who has nothing now, but there might have been a prince, or somebody held in high esteem in their own country. You never know who you're dealing with. And all I'm saying is, we're just human, we're all the same. When we take our nursing hat off, when we go home on an evening after a shift, we're tired, we're like everybody else, aren't we? We're just human. We have our own issues to deal with, Sometimes I feel anxious after a shift. I just want to have a drink of wine. Once that nurse's hat's off, you're just like the rest of everybody else. So you just have to remember that when you're dealing with people who are vulnerable, who need support and help. They're coming to you, they're putting their trust in you, they've got an expectation that you're going to be there to support them and listen and understand them, regardless of where they're from or who they are, Some people don't have any expectations because they might not have been in the mental health system before, but they've come for your help, so you are there, you owe it to them to show that you can do it, that you can do what you've been trained to do. And we don't always get the right training, even in university or on placement. I wouldn't be doing this if everybody knew how to nurse transculturally, because majority of people don't. And even people who've been in the job a lot longer than me, including doctors, and I'll say that, and psychologists, some of them don't have a clue, or they just kind of bypass it and think it's an afterthought. But really, it isn't, because, no two people are the same, and everyone's needs are different, regardless if they're from a different culture or they're just, from your next door neighbour. You wouldn't treat everybody the same. You'd treat them accordingly, according to their needs, the wishes, the beliefs, the culture, and what's important to them. Okay, so ditch your ego, open your mind, and you will learn so much in this wonderful career of mental health nursing. So number 7 is get used to being out of your comfort zone. And all these things you're probably thinking, they're proper cringe, like cliche, but this will set you up nicely, trust me. It'll set you up. As you're going into your career as a nurse, you'll be thinking, actually, yeah, she was right, it's the basics. But get used to being out of your comfort zone, because you will be out of your comfort zone from the minute you set foot on this course, because it's a long 3 years, and it's hard. It's not for the faint-hearted. You're a student, you're toying with all the things where you might be 18, and it could be your first proper serious job, like your grown-up job, or it could be like you've worked for years. You could be in your 40s and thinking, I feel like I'm back at school. You'll have all these thoughts and feelings about who you are, and you'll start to kind of be stripped down to your bare bones almost. Yeah, but just get used to being out of your comfort zone, because you'll be made to do presentations academically. You'll be standing up in front of your classmates, talking about God knows what. Yeah, you'll be asked to lead on a presentation in a group scenario. You'll have to do like role playing. You've got to do like you in your first year you'll be doing your CPR and all that kind of stuff. But you do things called OSCEs where you're doing like a proper simulation. Yeah, you'll be on placement dealing with real life patients. You'll be answering telephone calls, thinking, "Oh my God, I don't even know what to say on the phone. Like, just help me." You'll come across so many situations from the outset, which will have your knees knocking together, and you'll be like, "Oh my God, I don't think I can do it." Even writing an essay is daunting at first, until you get into your flow, until you start research, and then it becomes more interesting, then it becomes more easy. And even things like public speaking, some people, like I said, love it. Some people are comfortable with that. But then there might be the people who are terrified of actually having a face-to-face engagement with someone from a different country, or, who spoke a different language. Yeah, or whose views differ from theirs massively, and it's kind of like a bit of a conflict internally. Yeah, so just know that you will be tested and challenged at every corner of this 3 years. There's no getting out of it. You'll be asked to do things like draw up a depot injection. Yeah, do your drug calculation. You might be thinking, "Oh my God, how?" But with support, you'll do it. And the key is not to avoid doing it. Don't avoid situations that challenge you. If you maybe not used to working with people who are from a different cultural background, because a lot of people aren't. A lot of people have never had friends or acquaintances who are not from their own kind of cultural group, or they might have grown up with the same friends since school. And this also goes, this isn't just targeted at white people. I'm not kind of saying that this just applies. It applies to everybody, because there's been nurses who I've worked with and doctors who I've worked with who feel uncomfortable talking to people outside of their own kind of cultural group, or even within their own. They don't like to talk about certain things because it's stigmatizing, or it's just not the done thing, So I would say, if you feel that you've never maybe encountered a patient from a different cultural background to yours, or whose language is not English and you've got to use an interpreter, yeah, or somebody who's gone through a trauma, or you start feeling brave and start having the inclination to think, I want to do this assessment, or I'm going to go and have a one-to-one with this person, or I'll ring them on the phone, or I'll organise the interpreter, or I'll go to the mosque and speak to the faith leader, because it's important to them that they remain connected to the congregation, yeah, or I'll refer that person for chaplaincy. Start getting used to being out of your comfort zone to the point where you do go a little bit above and beyond, to make sure that that person knows that you've gone above and beyond. Yeah, and it's gone out of your comfort zone, because that person will appreciate it so much. And it demonstrates that you are culturally aware, that you've got an element of cultural competence, and these things don't go unnoticed. Yeah, people will have more trust in you and in the services when they know that their needs are being met. So don't be afraid to go out of your comfort zone. It's character building. It will set you up so well for when you become fully fledged, because it'll just become second nature. Point number 8, listen more and speak less. Okay, self-explanatory. You need to be listening and engaging your ears, engaging your brain, listen, and listen hard, okay? I'm not saying don't speak up, and I'm not saying don't ask questions, because asking questions to a degree demonstrates that you've been listening. where appropriate. Okay, pick your moments to ask questions, but do listen. Listen to your lecturers, listen to your mentor on placement, but listen to the people who you're caring for, their needs. They know themselves, even when they're ill. You know, to a degree, people are vulnerable, lose their inhibitions, or they make poor decisions. But you've got to listen regardless, even if you think you're a bit paternalistic and you think, I know what's best for this person. Sometimes somebody's telling you something and it can be overlooked. You might be thinking, oh, this person's delusional, they're talking about this constantly. There's probably something hidden in that. There's probably some truth in that. It might be a small element of truth, or it might be a big element of truth in that. But you've got to listen and you've got to discern, try and discern a little bit what might be actually true, what might be complete delusion. But unless you kind of inquire about it, you know, and listen, there could be some nuances, there could be some idioms of distress. They might be saying to you, my heart's aching, or my head is full, yeah, or, you know, some kind of expression of distress where you might think, oh, they're on about the heart again, you know, the psychosomatic, you know, they're talking about pain in the heart, and they might have a pain in the heart, but it could be that this person's expressing their sadness, their guilt, their depression through saying they feel pain in the heart. Yeah, things like this, like subtleties where, you know, I might say, oh my God, like my head's done in. My head's absolutely done in. Yeah. And somebody who doesn't know that expression might be like, head is done in. Like, what does that actually mean? I know what it means, and it means something to me and my pals, do you know what I mean? Who also say that. But to somebody who doesn't quite understand it, they might just take it literally, or, you know, think it doesn't really mean anything. But culturally, it could be pretty significant, you know? So listen good, because there's a lot of things that get missed. And if you're writing an assessment, like I said before, writing up an assessment or writing in someone's case notes, and you're documenting it in a way that's actually not how it should be, kind of, that this person's explaining something to you and you're kind of misinterpreting it, then it's not going to come across correctly in the records. You know, because care plans get drawn up from these things, risk assessments get drawn up from your findings, and if you're concluding something that's untrue or that doesn't actually reflect what that person's saying to you, then that person's going to get a flawed care plan. Yeah. They might even be treated completely inappropriately. Yeah, they might end up sectioned. They might end up... There's any amount of eventualities that could happen as a result of you not listening. But you've got to listen, and you've got to try and engage with them, you know. It's all about not just like plucking information, but engage with that person. Try and show empathy, you know. It's about being empathetic, trying to, you know, take a step in that person's shoes and try and fully understand where they're coming from. Because I've known people in you know, in recent years when I've done jobs where they've said, I was sectioned again and they didn't believe me, and this actually happened. Or I wrote a book and I was telling the doctor that I wrote a book, and the doctor thought I was grandiose, and then they actually found out that I did write a book. Do you know what I mean? Or somebody might say, when I lived in a certain country, somebody was targeting me. It was a political situation, and since I've moved to England, I feel that person, I've seen them around, and you honestly, the amount of times I've heard stories where people are not being believed, but there's truth in it, you know. People might be on edge, people might be suffering from PTSD and, you know, be hypervigilant, but more often than not, there's an element of truth in it. So if you don't listen and engage and fully try and immerse yourself in that conversation with somebody and write it objectively, do your writes up objectively in the words of that person, instead of kind of eliciting what you want for the purpose of your write-up to sound a certain way, or for it to kind of veer towards that person being referred onto a different service, or they end up getting sectioned or whatever, you've got to try and make it. You know, you use your professional judgment, clinical judgment, but it's not fair when you don't take into consideration cultural factors. Yeah. Or not just cultural factors, the person's own perspective of what's going on for them, you know. So just listen, and listen good, and make that be known in your written work, or in your kind of, when you're handing work over to the next shift. You might be an autonomous practitioner working in the community, but just it makes sure that it's reflected in your notes, and that every decision that you make is with sound judgment. Right, point number 9, reflect. And reflect every day. Reflect all the time, because it is so important within nursing. You'll know about reflection from day one. You'll be reflecting on your everyday practice, you'll be reflecting on yourself, you'll be reflecting on your own experiences of life. You'll just become that person who does, if you know, if you want to become a good nurse, then reflection will just become second nature to you, to the point where you won't do anything without reflecting on it. Even in your clinical supervision or your management supervision, you'll be reflecting all the time, okay? Especially as a student, when you're new, you'll make a lot of mistakes. You'll, you know, maybe think something is that it's not, and you might beat yourself up about it. You might fail an assignment, or wish you'd done better on this simulation exercise. You know, you might be told to F off by a patient, you know, whilst giving them the medication. You might end up assaulted, because it does happen. You know, there's just so many, no 2 days are the same in this job. Yeah, and every day you learn something new about the role, your patients, yourself. You'll sometimes question whether or not it's for you. You might want to quit halfway, you know, but everyone goes through it, and you'll always go through it. You might think, I didn't make the best decision there, or that person's, you know, God forbid if anything would happen. You know, you constantly criticising yourself and reflecting, but it's part and parcel of developing as a nurse and becoming a better practitioner. You know, we do reflect a lot. You'll be asked to do reflective pieces academically. You might be told to reflect on a shift, you know, reflect on a ward round, reflect on a day that you were on your management placement and you took charge of a shift. Yeah, reflect on the time when you went to see, I don't know, reflect on a time when you went to see this lady who had very deep spiritual beliefs, and all she was doing whilst you were there was preaching. Yeah, she was speaking in tongues, she was sprinkling holy water, she hadn't eaten for days because she was fasting. Yeah, reflect on that. Reflect on everything, but reflect particularly, again, in the context of nursing transculturally. Always reflect on things like that, because so many times, and I've seen so many times, it's like, it's heartbreaking, it's frustrating to me as a nurse. And I see people from African countries a lot of the time, coming in and out of the services, the crisis service where I used to work. Yeah, and it does upset me sometimes, because I think people just assume that because this person's got a religious belief or a strong faith in God, or they're from a third world country even, that they're a bit sort of primitive or a bit backward, or they put too much emphasis on God, therefore they must be delusional, or they're praying all the time, they're not eating. Why aren't they not eating? Well, they're actually fasting. Did you not know that people fast to try and cleanse themselves, yeah, and become closer to God? Yeah. And it just like, and I think it used to frustrate the life out of me, and I used to think, why don't people understand? Yeah. And sometimes I used to talk to the patients, and they'd be like, you're the only person who's ever asked me about my faith or my culture. Like, does this not get talked about, you know, in your services? Yeah. Or they don't get referred to chaplaincy if they're on the ward. Why not use spiritual and pastoral support? Yeah, you can reflect on these things. But then, you know, next time, that if this person's saying that they're being possessed by jinn, or that there might be a religious element or a spiritual element, and do they have support for that? Does their faith leader know that that's what they're going through? You know, does the faith leader not kind of understand mental illness and therefore making that person feel that they've done something wrong to deserve it? Start asking these questions and start reflecting on it, because it will just it'll blow your mind. It's absolutely fascinating, you know, and it just goes so much more beyond the textbook stuff that you'll get taught. The academic stuff's fascinating. I used to love it. Yeah, I used to absolutely love writing essays and stuff. But actually, the learning comes when you're actually engaging with people. These are the people who you're caring for, and you'll learn so much from people as long as you start opening your mind, being critical, and start reflecting and start improving, because that's the way you become a really good nurse. Okay. And point 10 is speak up. You've got to learn to speak up within your practice. You'll come across things as a student where you'll think, I don't like the way that person spoke to me, or my practice mentor is an absolute see you next Tuesday. You know, you will come across things that you won't be happy with. You might not like the way a patient's being treated. You might not like the way a patient spoke to you, or they might have racially abused you, or, you know, I had a practice mentor who was absolutely brutal. She was awful. She didn't like me. She didn't want to have a student. She embarrassed me, showed me up in front of one of the doctors when I told her that a lady needed some help. And I was absolutely fuming. I was absolutely livid. I thought, who are you to talk to me like that? I might be a student, but I'm here looking after this woman who you're not looking after. Yeah. And this woman didn't speak English, funnily enough. But she was an older lady and she was lovely. So I spoke to one of the clinical leads and I said, I'm sorry, but I don't want her as my practice mentor anymore. And I spoke to one of the academic mentors at uni who came up to see me on placement, and it was agreed that she wouldn't be my mentor anymore, and that was the end of it, really. And the person who took over from me was the person who I confided in, and I said to him that I wasn't happy about that. And he said, look, I respect you, I totally respect you, because you spoke up, and this happens a lot. You know, it happens a lot to students, and, you know, you've had the courage to speak up, and that lady needed support, you know, and you did what was right. So if ever you're in that situation where you feel like something's not right, or you feel a bit singled out, or you feel like you're not learning anything in practice, maybe your practice mentor just can't be bothered. They want somebody who doesn't ask too many questions, somebody who just keeps quiet, and somebody who just somebody who's not in the way, somebody who doesn't challenge them. Speak up about it, because you're not going to get the most out of your training. Because 3 years, it is a long 3 years, but it comes and goes. You practice placements are the opportunity to start learning, and really learning about yourself and about how to deal with people. Yeah. You need to be able to speak up and find your courage. Because you might be able to speak to people, you know, in general, but you might be forced into a situation where you might have to say something that you really don't want to have to say. You know, it might not directly involve you, but you might have to say something. You know, and I'd say pick your battles wisely, because there'll be lots of things where you think, I don't know about that. You might think, I just don't need the headache of saying something, or maybe it doesn't directly affect you or a patient. Or you might just think, I'm going to let that one lie because I don't want to waste my energy. But if there's something that doesn't sit right with you, then definitely speak up. Talk to one of your uni lecturers. Talk to whoever you feel comfortable to talk to. Just talk it out with them and get some support, because that's what they're there for. They're there to help you, and, you know, don't let anyone force you into doing something which you're not comfortable with. Although, like I say, do go out of your comfort zone. Do go out of your comfort zone, but do it in a way that's structured. You know, you can kind of action plan these things, you know, but do speak up. Do not suffer in silence, because you're working in an environment where people are not well. Yeah, people are generally not well and vulnerable and are counting on you once you're qualified. But as a student, you might gain so much more from a nurse because you're not qualified and you maybe don't pose as much of a threat. Yeah, but do speak up and never let anything fester, because it can start affecting your own mental health as well. If you don't feel understood or if you feel belittled in any kind of way. Yeah, so I could waffle on and on and on about these things because I love it. And even in my own line of work, really, I don't get to talk like this. So it's refreshing, and I just hope that it helps people maybe have a different perspective on what to expect within mental health nursing, because I think some people have their own expectations, some people don't know, but it's good to have different views, and I'm here to share my views. And so if you'd like to hear more about transcultural mental health nursing, then like, share, subscribe to my channel, and I will definitely promise that I'll keep giving you more content. So yeah, I'm happy to help, guys. I hope this has been useful. I hope it's been informative, and I hope it's been interesting. So stay tuned for some more exciting content. I love you and leave you for now, guys. Bye.